Assalamualaikum doctors. In this video, I am discussing a clinical neurology session. So I entered into the room and the examiner telling, do the lower limb motor examination of this child. So first I wash my hand, introducing, hello, good morning. I am Dr. Rima, one of the children doctor. And I take the permission from the mother if the child is big. So from mother is safe. I want to examine child lower limb. Is that okay with you? Then after that I will look at the child and I'm asking him a question. So how are you? Mm, what is your favorite color? Nice shirt you have wear. In the meantime, I'm looking at his mentality, that he is well communicating or not. Is there any distress or not? Is there any device surrounding or anything in the tablet form? Anything? I will look at that, and dysmorphic device distress he is or not. Then already I wash my hand. Then I tell the child, I handshake with the child. Handshake the child and tell him, give me a very beautiful smile. So when he give the smile, I look at his face, that any seven cranial nerve palsy present or not. And I also am looking, is there anything present or not. Sometimes nystagmostosis, these are. So Charcot Marie disease I am discussing here, I will not find, but in hand I can be find. There is hand is like the claw hand due to wasting of the small muscle of the hand. So that is called Charcot arthropathy. So claw hand I can notice, that is one clue. After that I'll tell the child, can you please stand? He will be stand. Fold his leg to the mid thigh, expose, and I sit. I look very nicely. I inspect his leg. So what is I find? Special shoes can be find. Pes cavus. Remember, pes cavus can be find wasting the distal muscle, giving the shape of inverted champagne bottle. So ankle is so much wasted. That is that given the shape of inverted champagne bottle. Inspection I will do the leg. That I am going to the back. I just look at his back, that any kyphosis present or not. Sometimes present. I just touch the mid vertebra, that any kyphosis present or not. He just bend forward and notice that it is disappear or not. Anything I will look at this scapula, any wanging of scapula, anything present or not. Then I tell the child, can you please walk to the door and come back to me. So I find there is high steppage gait. Okay. So how high steppage gait I will find, like knee is high, then the toe. Touch the floor fast, then the heel. March gait. It's like a marching heels. Normally the heel touches the floor fast, then the toes. So high static gait, then I will tell the child, can you please lie on the couch? So he lie on the couch. First I measure with the hand, there's any limb length discrepancy present or not. After that his he will be exposed up to mid thigh, his pant. So again I am look inspection, this anything I find, like any scar mark, anything. Then I will check the tone, tone of the ankle joint, tone of the knee joint. So tone is reduced, I find that is hypotonic. Then reflex, tone, power. First the child will be raise his leg against the gravity. Then I will give pressures against the resistant, both hip joint, knee joint, ankle joint. I'm checking. Then reflex we are doing. Reflex maybe in normal or negative the Babinski, but never hyperreflex, remember. So tone, power, reflex I have seen. Then coordination I show him, heel shin test, how can he do. That is maybe normal sensation also when I see that. So after that I would like to complete my examinations, full neurology examination, upper limb examinations, cranial nerve examination. So upper limb there is claw hand. I would like to ask history, like family history. Charcot Marie disease is an autosomal dominant conditions, and history of any trophic ulcer, foot ulcer, burning sensations disease. So now presenting case, today I examine suppose Adam is an 8 years age old boy. He is I do his lower motor examinations, and I find he is well communicating, no any distress, no any device attached, no any dysmorphic features. And on inspections of the leg I find that is severely wasted the distal muscles, that is ankle joint is wasted, and that is giving inverted champagne bottle. And also I look at that there is pes cavus present, And claw hand I find, the claw hand also I have find. One thing I forget, that when he has high steppage gait, so proceed to the Rombach test. Ask him to sit from standing positions. Only posterior clamp, so no ataxia. Okay. So inspection I do that. I find that is imbrate champagne like leg, then pes cavas and claw hand. I find, and that is back. If scoliosis is present, kyphos is present, then I will tell that what I find. Gait is, that is high steppage gait. They have tone reduce, power reduce, reflex is also normal or reduce. Okay. The heel shin coordination test is normal, and sensation is intact. So putting together, it is a case of hereditary sensory motor neuropathy, Charcot Marie disease. Now, how can I manage these conditions? For management conditions, first I will take the history, revise my note, what investigation already done or not. Then I will do some investigation, diagnostic, genetic testing. Chromosome number 1, it is an autosomal dominant condition, is most common type, but with multiple inheritance mode. Nerve conduction velocity, nerve biopsy give onion bulb appearance, and radiology except the spine. So mainly genetic testing we are doing. It is an autosomal dominant conditions. Chromosome number 1, nerve conduction velocity, nerve biopsy given onion like appearance, and X-ray we can do spine for scoliosis. Then treatment I am giving, stabilizing the ankle joint with ankle foot orthosis, phenytoin or tegretol for burning sensations in foot, and physiotherapy. So phenytoin and tegretol for burning sensation in the foot, physiotherapy, and stabilize the ankle joint with ankle foot orthosis. I will involve the multidisciplinary team, neurologist, physiotherapist, occupational therapist, orthopedic for joint stabilization, genetic counseling of the family, lies with the school, and psychological support. So as well, what are the DD of neuropathy? Hereditary motor sensory neuropathy, that is like diabetes mellitus, hypothyroidism, vitamin B12 deficiency. So remember, high steppage gait, where we find high steppage gait, we can find unilateral and bilateral. Bilateral like Guillain-Barré syndrome, Charcot Marie disease, peripheral neuropathy due to vitamin B12 deficiency, diabetes mellitus, thyroid, drugs like vincristine. And unilateral we find spinal cord tumor, spinal cord tumor, nerve injury, fibula fracture, peroneal nerve injury, and trauma. This is very important DD. It comes on video station. So high steppage gait I am looking, that has bilateral and unilateral cause. Bilateral are GBS, Charcot Marie disease, peripheral neuropathy due to vitamin B12 deficiency, diabetes mellitus, thyroid, drugs like vincristine. Unilateral are spinal cord tumor, nerve injury due to fibula fracture, and peroneal nerve injury and trauma. So this is all about Charcot Marie disease, where we find high steppage gait. Thank you.